Hey, my name is Katrina Bird, or my patients call me Dr. Bird, and welcome back to my channel. So today we're going to talk about tetracyclines. You're going to learn how they work and what they treat. So if you're interested, stay tuned. As you know, we're talking about tetracyclines, so let's just jump right on in here. All right, so I like to go through this just to remind ourselves, if we remember where the antibiotics work, then that helps us determine what they cover. So today we're going to talk about tetracyclines. In our last video, we talked about aminoglycosides, so I'll put a link up above. All right, so let's talk about how they work. So tetracyclines, along with aminoglycosides, actually inhibit protein synthesis. So that's like the short answer of all of this. However, specifically in the translation portion of protein synthesis, the tetracycline will bind to the 30S subunit. So you have 30 and 50S, and this is what the ribosomal units you'll have in bacteria. So it'll bind to the 30S subunit, preventing this tRNA from bringing the new amino acid and thus inhibiting the protein or the amino acid chain from elongating. And it pretty much stops protein synthesis in its track. And that's how it basically kills bacteria. All right, so let's talk about a few mechanisms of resistance. All right, so let's just go through a few principles. So one way in which bacteria can become resistant to an antibiotic is if they have an efflux. So the antibiotic gets inside the cell. Remember, tetracyclines work on protein synthesis, and this process works inside the cell. So it needs to get inside the cell in order for it to work. But some bacteria have these proteins that basically pump the antibiotic out, called efflux pump. And basically, if the antibiotics aren't able to get inside the cell, then they can't kill the bacteria. The other mechanism is they can basically prevent influx or prevent the antibiotic from getting inside the cell. The other thing is either the kind of changing the target. Specifically, one mechanism for aminoglycosides is that it'll change the 30S subunit so that it doesn't recognize it. And the last one is some sort of enzyme that will inactivate or break down the antibiotic. So let's just go through a few mechanisms of resistance specific to tetracyclines. All right, so the pretty common one is efflux pump. So as I just stated, the antibiotic is basically, it goes into the bacteria, but this pump pushes it out. So thus the bacteria is resistant to whatever tetracycline we're looking at. Another example is enzymatic inactivation, but probably the most common and the most kind of prevalent mechanism of resistance is this ribosome protection. So specifically, there's some sort of like cytoplasmic protein that binds to the 30S subunit where tetracycline would normally bind. And because when tetracycline tries to bind to the 30S subunit and there's already somebody there, they're like, oh, okay, well, now it can't work. And that is the reason why you have a resistance in that case. All right, so let's talk specifically about tetracyclines. So in general, tetracycline was first discovered in 1953. So relatively old drug, not the oldest. Penicillin would be the oldest. One good thing about tetracyclines is pretty broad spectrum. It has gram-negative, gram-positive coverage. It has a little bit of anaerobic coverage because it will cover Bacteroides fragilis, and it also will cover our atypical infections. And however, currently doxycycline and minocycline are the primary tetracyclines used today. So doxycycline and minocycline are considered second generation tetracyclines. There may be some instances where people use tetracyclines, but primarily it's doxycycline and minocycline that are used today. few more principles. You definitely want to avoid using these medications with cations like magnesium, calcium, multivitamins. Why? So when you, most of the time we're giving these drugs by mouth, and this is primarily where you're thinking about oral administration of these medications. So for example, you take your doxycycline and you also take your calcium supplement. It's really important that the doxycycline gets absorbed in the GI tract in order for it to work. However, what happens is if you take it with a cation or calcium, that cation will prevent the doxycycline from being adequately absorbed, and thus it can lead to treatment failure. I've definitely seen little old ladies put on doxycycline, and I'm like, oh, okay, this medication should have worked. However, they tell me, oh yeah, I take my doxycycline with my Ensure, which has like dairy and has like, a lot of cations in it. So then I'm like, oh, okay, I see why you failed this treatment. And other things you have to worry about, drug-drug interactions, so for example, warfarin and doxycycline, you should be careful when you prescribe them together. There are other medications that you want to avoid with doxycycline. So, or be very cautious when you prescribe them together. So your pharmacist can help you out with those. So common side effects include GI. I put GI upset, but typically people tell me when I take the doxycycline, I get stomach cramps. So I typically will tell people to take it with a little bit of food, obviously not dairy, but take it with a little bit of food, and it helps ease or totally eliminate the abdominal discomfort, and not everyone feels this. So the other thing you want to do, like when you prescribe this, you want to tell your patients that it can increase photosensitivity. So specifically, I tell people if they're on doxycycline, for example, they should avoid direct sunlight, or if they're going to be in direct sunlight, wear plenty of sunscreen and really try to actually wear layers to protect the skin, because you'll have like really, 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 really bad sunburn, even in darker skin patients. The last thing that's not on the slide you want to kind of warn patients, especially with doxycycline, is pill esophagitis. So sometimes when you take the pill, it can actually get, there's a risk that it can get kind of stuck in the throat. So it's important to really tell people to, when you take these pills, although they're tiny, take them with plenty of fluids and actually sit upright for like 15-20 minutes before taking the medication. So just a few pearls regarding these. And then the last thing I want to say before we kind of go into some detail is doxycycline really concentrates well in the urine. So it's actually a really, really good medication for urinary tract infections. So especially like if you're having like a Pseudomonas or kind of a lot of resistant organisms, you can kind of overcome that resistance with doxycycline because you get such high levels in the urine. But if you have any questions, you definitely should ask your friendly infectious disease physician or pharmacist regarding that. All right, so let's talk a little bit detail about doxycycline. We won't go into as much detail tetracyclines because they aren't commonly used nowadays. So let's go through some things. So I have this. This is kind of like purplish, and it's like in a little cluster to represent our kind of staff. So doxycycline will cover MRSA. It will cover vancomycin resistant enterococcus. That's what VRE stand for, in most streps, including strep pneumo. So this purplish kind of reminds us that these are all like gram-positive organisms. The other thing it will cover is, again, strep pneumos and are atypical. Like It will cover, for example, Legionella, a lot of atypical pneumonias that we would treat. It also has some gram-negative coverage, so I just wanted to stress that. And it also is our treatment of choice for our tick-borne diseases. So doxycycline is our treatment of choice for Lyme disease, although for children and mild cases, you could also give amoxicillin. It is treatment of choice for Rocky Mountain spotted fever, anaplasma. So a lot of different tick-borne diseases. If you're not sure what they have and they have some sort of tick-borne disease, go ahead and give Doxy. There are some tick-borne diseases like Babesia that Doxy does not treat, but you know, if in doubt, give Doxy. All right, so let's talk a little bit about minocycline. So minocycline is going to have very similar coverage to doxycycline. However, out of all the tetracyclines, this is going to be the best one you can use for MRSA coverage. It works, well, MRSA coverage, but staph coverage in general. Like Doxy covers staph, it covers MRSA, but if you're thinking in the tetracycline class, which antibiotic can I give that's going to have the best staph coverage, you want to think minocycline. So these are just gram-positive. Remember, our gram-positive organisms are purple, and they're in clusters to signify staph. All right, but the one thing you should know, unfortunately, long-term use of minocycline can lead to this bluish discoloration of the skin. Oops, there was a typo. That's supposed to be skin. Sorry, guys. So this is a lady who was on minocycline for 9 years, and all of a sudden her skin kind of turned blue. This was actually a case report, and she was discontinued, like the minocycline was stopped, but her skin remained the same, unfortunately. So this is like, minocycline is actually a really, really good drug. We prescribe it only for short periods of time because of this side effect. All right, that's all I have for you. If you want some details on dosing, please check out my IG account. Thank you for watching this video. If you enjoyed it, please click like and don't forget to subscribe to my channel. Thanks.